Now let's move on to the anterior view of the skull. Taking a general view, the skull can be seen to be spheroid in shape. For easy description, the skull can be divisible into 6 aspects or 6 regions, seeing the skull as a cuboidal shape roughly. However, it is not just an exact cuboidal shape. So, inasmuch as the regions are not defined sharply but pass into one another with more or less an overlap, the skull is oriented in a standard anatomic position. The Frankfort horizontal plane for descriptive purpose. I will explain the Frankfort horizontal plane in these left pictures. The Frankfort horizontal plane means the line connecting the inferior margin of the orbit and the superior margin of the external acoustic meatus. In this figure, these points are the inferior margin of the orbit, and this point is the superior margin of the external acoustic meatus. This FH plane is widely used in orthodontics. In orthodontic cephalometry, this plane or line joins the parian and orbitail. The parian means the superior margin of the external acoustic meatus, and the orbitail means the inferior margin of the orbit. These landmarks will be discussed somewhere later in this chapter. Let's go to the right figure. I will explain facial view of the skull. The facial view of the skull can be called as a frontal view or anterior aspect of the skull. Viewed from the skull is generally ovoid in shape and wider above than below. Like this. When the skull viewed anteriorly, the anterior end of the cerebral cranium or forehead and the bones of the face are seen. This is the anterior end of the cerebral cranium, which means the frontal bone, and the remainder is the facial bone. This is the face. In other words, the facial view of the skull is mainly composed of the facial bones except the frontal bone. The frontal bone is included in the neurocranium or cerebral cranium. The configuration of this region is adapted superior to the frontal lobe of the brain. Inside of this brain case, there is a brain, specifically the anterior lobe, are located inside of the frontal bone. Like this. While inferiorly, it is largely determined by the presence of the eye, nose, and mouth. They can be described as orbits. This is the orbit, which houses the eyeball, and nasal skeleton, which supports the nose, and the jaws. Jaw means the maxilla and mandible together. In the anterior view of the skull, we can see the frontal bone, nasal bone, maxilla, zygomatic bone, and mandible, or 5 bones primarily. And we also may see the portions of the sphenoid, temporal, lacrimal, and ethmoid and palatine bones. Now, let's find these individual bones in this right figure. Frontal bone, nasal bone, zygomatic bone, maxilla, this is the right maxilla, and the mandible. You can see mandible very easily. These 5 bones are primarily occupy the anterior aspect of the skull, and some of the small portions can be seen in this picture of sphenoid, temporal, lacrimal, ethmoid, and palatine. We can find these bones in this picture. The lacrimal and ethmoid and sphenoid, lesser wing and greater wing, and around this there is a small portion of the palatine bone. These bones can be see their portion in the anterior view. We can divide the anterior view in 3 portions: the upper part, central part, and lower part. The upper part of the frontal bone of skull consists of the frontal bone, like this. The central part of the face occupied mainly by paired maxilla separated by the anterior nasal aperture. This is the anterior nasal aperture, the opening of nose. Each maxilla contributes the upper jaw, the floor and medial wall of the orbital cavity. Floor, this is the maxilla, and small portions are contributes the lateral wall of the orbits, and the lateral wall of nose. We cannot see in this picture because it is located inside of the anterior nasal aperture, and the floor of nasal aperture, floor of bony nasal cavity, and the bones of cheeks around here. The lower part of face below the nose is formed from the alveolar arch of the maxilla, alveolar arch of maxilla, and upper dentition, and the body of mandible, alveolar process of mandible, and lower dentition. The anterior view can be divided in 5 regions: frontal region, zygomatic region, and nasal region, and jaw region, roughly. Okay, I will talk about the frontal region. The frontal region is composed of the squamous part of the frontal bone, which underlies the forehead region above the orbit. Superomedial to each orbit is a rounded superciliary arch, here, like eyebrow, between which there may be a median flattened elevation, the glabella, here. The superciliary arch is more pronounced in males, but not prominent in Asian population usually. The glabella may show the remains of the interfrontal suture or frontal suture, which is originally located in this area in fetal states, which sometimes differently called as a metopic suture. This suture usually closes in the first postnatal year, but persists in a small percentage of adult skulls in various ethnic groups, about from 20 to 40% by some investigators. The low bulging on either side of midline of frontal bone is termed frontal eminence. This area, the superciliary arch, is located between the frontal eminence and the supraorbital margin. The frontal bone articulates with 2 nasal bones at the frontonasal suture. This is a frontonasal suture, and this is the nasal bone. Marked by the depression at the root of nose. the point at which the frontonasal and internasal suture meet. Here, in green dot, is the anthropometric landmark or orthodontic landmark known as the Nasian. I will write different color for better seeing. Below the superciliary arch, there is a supraorbital margin. I drew this line just before. There is a supraorbital margin. In the medial third of the supraorbital margin, there is a supraorbital foramen or notch. Around here, that transmits the supraorbital artery and nerve. Zygomatic region. This region means the convex upper lateral part of the cheek around here is composed of the external surface of the zygomatic bone. There are small zygomatic orbital foramen around here bilaterally, which transmits the nerve and vessels of the same name, zygomatico orbital foramen. The next region is orbit. This part can be considered as the highlight of the anterior aspect of the skull and is a little bit complicated and long, so it will be discussed in the next separate session. Nasal region. The nasal region is composed of nasal bone here and frontal process of bilateral maxilla around here, and the perpendicular plate of the ethmoid bone inside of the piriform aperture, finally the piriform aperture. The frontal process of maxilla ascends. Frontal process of maxilla ascends like this way, posterolateral to the nasal bone, to articulate with it medially, the frontal bone superiorly, and the lacrimal bone laterally. This is articulated with the nasal bone medially, superiorly the frontal bone, and with lacrimal bone the laterally. The anterior nasal aperture is a piriform in shape. Wider below than above. Opposite of the general shape of the skull. It's bounded by the paired nasal bone, two nasal bones, and maxilla. Two maxilla. The upper boundary of aperture is formed by the nasal bone, while the remainder is formed by the maxilla. In life, several nasal cartilages such as septal cartilage, lateral nasal cartilage, major and minor alac cartilage help to delineate two nasal cavities. The shape of these bones can be used quite successfully to predict the shape of the cartilaginous nose in forensic facial reconstructions. The anterior nasal spine here marks the upper limit of the intermaxillary suture here. At the lower margin of the anterior nasal aperture is palpable in the nasal septum. The large space inside of the anterior nasal aperture is the bony nasal cavity, which is separated by the bony nasal septum here. Let's go to the final region in this session, the jaw region. There are maxilla, mandible, and upper and lower teeth in this region. There are infraorbital foramens in the maxilla, here and here, which transmits the infraorbital vessels and nerves and lies about 1 centimeter below the middle of the infraorbital margin. The infraorbital margin and this distance is around 1 centimeters. The maxillary alveolar process bears the upper teeth. Corresponding to the root of these tooths are rounded elevation of the surface with intervening depressions. We call it as alveolar yolk. This is the alveolar yolk. The alveolar processes and adjacent body of maxilla meets in the median plane and the intermaxillary sutures here. The short, thick zygomatic process of maxilla has an oblique upper surface that articulates with the zygomatic bone at the zygomatic-maxillary suture here and here. The body of mandible with its teeth can be seen in the lower part of the jaw region. In the midline, the mental protuberance around here produces the characteristic prominence of the chin. At this location, the mandibular symphysis fused in the earlier stage of development. The mental protuberance extends laterally and reaches a bit projecting mental tubercle. Like this way, mental tubercle. This is a mental protuberance. There are oblique lines projecting from the mental tubercle, from mental tubercle to the ramus of mandible like this. And this line marks the attachment of the depressor labii inferioris and depressor anguli oris and some portion of the platysma muscles.